Do you know what happens to your body when your blood volume is low or you have low sodium? I guess you'll be thinking about it, right? But don't worry. At the end of this video, we are going to enter all details and you will know a lot of things that will happen when your blood volume is low. On today's segment, we are going to learn about RAAS, commonly known as Renin-Angiotensin-Aldosterone System. So we are going to talk about what happens to our body when our blood volume is low, and then what I just called or mentioned right now are the physiological processes our body undergoes when we have low blood pressure or low sodium. So let's talk about Renin-Angiotensin-Aldosterone System. What is it about? So it's actually a system that detects low blood pressure or low sodium. So during this process, we have three organs involved, and then we have the kidney, the liver, and then the lungs. So we'll dive into it and see what these organs play, the roles that they play during this process. So for the kidney, what happens is that it detects blood volume whenever it is low. This is because it helps in filtration. So whenever it is filtrating blood and then the blood volume is low, it detects it. Since it's through the kidney, the blood will pass before it will get to the heart. So when the blood volume is low, the kidney detects it. And there's a cell within the kidney known as juxtaglomerular cell. I said what? Juxtaglomerular cell. This is a cell that produces an enzyme known as renin. This renin is released into the bloodstream and then it is transported into the liver. All right, I'll take that place again. So within the kidney, there's a cell known as juxtaglomerular cell, which produces an enzyme known as renin. This renin is being released into the bloodstream and then is being transported into the liver. So when it gets to the liver, it activates a plasma protein, which is being synthesized by the liver, known as angiotensinogen. This angiotensinogen is not active, and then liver produces a lot of plasma protein, and then angiotensinogen is not only the protein it produces what we call the albumin. But you see this angiotensinogen, it is not active. It is in its inactive form. The renin activates it to what we call the angiotensin 1, right? So from the angiotensin 1, now it becomes active. So it will now transport itself to the lungs. Now with the help of an enzyme within the lungs known as what? ACE, also known as angiotensin converting enzyme. It now converts angiotensin 1 to angiotensin 2, also known as vasoconstrictor. And then what does this angiotensin 2 does? What it does is that it constricts the vessels within the blood. It constricts the vessels. So what this angiotensin 2 does is that it constricts the vessels. That's why we call it vasoconstrictor. And then when it constricts the vessels, it increases what we call peripheral resistance. That means that the resistance within the vessels will be increased, increasing the cardiac output due to the increase in the heart rate to force the heart to pump more blood into the system. So basically, when the blood volume is low and then the vasoconstrictor is being activated, it will now increase the peripheral resistance, increasing the heart rate, and then the cardiac output will also be increased. Then more blood will be ejected into the system, now increasing the blood volume. So from low blood volume to a bit high volume or more high volume. Also, it does not end it there. The vasoconstrictor, which is the angiotensin 2, also work on the kidney. So at the kidney level, we have the outer layer known as the cortex, as you all can see right here. So the cortex contains what we call the aldosterone, which is an enzyme. The cortex contains a hormone known as aldosterone. So this hormone, what it does is that it signifies enough sodium. So it helps in retention of sodium. It doesn't allow much sodium to leave the body as at that time. Because of that, the sodium retain a lot of fluid back into the system. And we all know wherever there is sodium, there is water because sodium attracts water. This helps in increasing the blood volume. So with these physiological processes, I hope we now understand what happens to our body whenever our blood volume is low or our sodium volume is low. If you find this video useful, make sure that you share it, you subscribe and comment.